COVID awareness training, what you need to know about COVID-19. The learning objectives for this course. What is coronavirus or COVID-19? What are the symptoms? How does COVID-19 spread? What is the risk? What are some do's and don'ts? What should you do if you feel sick? And what are some precautions that employers can take? First, what is COVID-19? COVID-19 is a disease caused by a newly discovered strain of coronavirus called SARS-CoV-2, which can cause much more serious health effects. It is highly contagious and has affected millions of people worldwide. It has always been a mystery, with the scientists battling to find a perfect cure for it. It was first identified in December 2019 amid an outbreak of respiratory illness cases in Wuhan City, Hubei Province, China. People should be well aware of the disease and its severity to prevent potential exposure to the SARS-CoV-2 virus that causes COVID-19. There are various symptoms ranging from most common, less common, and serious symptoms. Let's look at the most common symptoms first. Fever, dry cough, and tiredness are the most frequently experienced symptoms. Less common symptoms include aches and pains, a sore throat, diarrhea, conjunctivitis, headache, and loss of taste or smell. For some people, serious symptoms are experienced. These symptoms might include difficulty breathing or shortness of breath, pain or pressure in the chest, and loss of speech or movement. There are also asymptomatic COVID patients, and these are people who are infected with COVID-19 but do not exhibit any sort of symptoms. Many of these asymptomatic COVID patients are unaware they are even infected. This increases the risk of spillovers to more vulnerable people out there. How does COVID-19 spread? COVID-19 is transmitted from person to person, mainly through coughing, sneezing, talking, and breathing. Droplets are respiratory secretions from coughing or sneezing that can land on mucosal surfaces, like your nose, mouth, and eyes. And this is one way that COVID can be transmitted. Another way is through contact. If you touch something, whether it's an inanimate object or another person, that has the SARS-2 virus on it, and then you touch your own mouth, nose, or eyes, you too can become infected. Aerosol is the third way. An aerosol is a solid particle or liquid droplet suspended in air. If you breathe these in, you can get COVID that way. Who is at risk of contracting COVID-19? The risk for severe illness increases with age, with older adults at the highest risk. Also, people with pre-existing medical conditions, such as asthma, diabetes, or heart disease, are prone to show severe symptoms. If you have a weakened immune system, you may need to take extra precautions to prevent contracting COVID-19. But remember, all people are susceptible to COVID-19 infection. How can you prevent COVID-19? There are some do's and some don'ts. Let's look at the do's first. Do wash your hands or use sanitizer frequently. Do wear a mask. Make sure it covers your nose and your mouth. Do avoid being in crowded places. Do stay indoors if possible and avoid close contact with anyone. Now for the don'ts. Don't panic. Take it easy. Do not spit. Don't touch your face. Avoid participating in social gatherings. Avoid using public transport. And don't rely upon self-treatment. What should you do if you feel sick? It depends on if your symptoms are severe or mild. If your symptoms are severe, you may have to be hospitalized. If you believe you may have the coronavirus, you should stay home and contact your healthcare provider. You should self-quarantine yourself until medical assistance is provided. And if you face difficulty breathing or other severe symptoms, you must be hospitalized immediately. On the other hand, if your symptoms stay mild, you might not have to go to the hospital, but you should still self-quarantine and avoid being around others. If your body is showing mild symptoms like cough, loss of taste or smell, or mild fever, don't go to the hospital immediately. Instead, seek medical assistance at your house and continue to isolate yourself from others. If you are in urgent need to leave your house or have someone near you, make sure to wear a medical-grade mask to avoid infecting others. As an employer, there are various precautions you can take for protection of your employees. First, provide hand washing and sanitizing supplies. If you already provide these, increase the amount you provide. Set up physical distancing and control customer flow. You can post signs to stay 6 feet or 2 meters apart. Install barriers between workers where feasible. If any worker does appear infected, make sure to send them home quickly. Provide personal protective equipment, such as face masks or gloves, as needed for the activity being done. And train your employees on specific protective measures required at your workplace so that everyone understands the importance of adhering to them. Now it's time for a quiz. Let's test your knowledge. How does coronavirus transmit? When a person sneezes or coughs, droplets spread in the air or fall on the ground and nearby surfaces. If another person is nearby and inhales the droplets or touches these surfaces and further touches his face, eyes, or mouth. If the distance is less than 1 meter from the infected person, or all of the above. It's all of the above. Where was the first case of novel coronavirus identified? Was it Beijing, Shanghai, Wuhan, or Tianjin? It was Wuhan in the Hubei province. Name a clinical trial in which blood is transfused from recovered COVID-19 patients to a coronavirus patient who is in critical condition. Does this refer to plasma therapy, Solidarity, remdesivir, or hydroxychloroquine? It's plasma therapy. Who is susceptible to COVID-19 infection? Just children below the age of 10, adults above the age of 40, senior citizens, or all age groups? All age groups. Some groups may experience more severe symptoms than others, but everyone is susceptible to infection. Which of the following is not a symptom of COVID-19? Nose bleeding, loss of taste or smell, dry cough, or diarrhea? Nose bleeding is not a symptom of COVID-19. The other three are. Can a person showing no symptoms still be infected with COVID-19? Yes, this is true. You can be an asymptomatic COVID-19 patient. Which of the following is a protective measure against COVID-19 incorporated by organizations? Sanitizing the facility, regular cleaning, ensuring physical distancing, or all of the above? Sanitizing the facility is an action taken by organizations to help prevent the spread of COVID. Novel coronavirus is the same as COVID-19. True or false? False. Mild symptoms of novel coronavirus are fever, diarrhea, loss of taste, or all of the above. All of the above are symptoms that you can experience. President Donald Trump told Americans the spread of the coronavirus may slow with warmer weather. Can the COVID-19 virus spread in hot and humid climates? Yes, it can spread in hot and humid climates. Thank you.